Okay, so now we're going to do an inferior glide. So I've positioned myself in a position such as the lateral side here, and I'm just doing a little grade 1 distraction. I'm going to place my hand not on the AC joint, but below on the head of the humerus, and I'm going to move down. So I'm going to do a sustained grade 2, just taking up the slack, moving down and holding that. If I want to do oscillations 1, I come back up and I do oscillations. The frequency is high, but the amplitude is low. And again, this helps to diminish muscle spasms, decreases pain, and helps to move the synovial fluid. Okay, so I'm going to show you how to do an anterior glide. Now, often we do an anterior glide from a prone position, but I can do it from this position. If the person had adhesive capsulitis or frozen shoulder in the subacute to chronic stage, I wouldn't use this to increase mobility. I'm just showing you as a method in which you can use to diminish pain and muscle spasms. So I'm going to do a sustained grade 2, little distraction, and an anterior glide. So I'm taking my web of the hand, I'm over the clavicle, and I'm over the AC joint, and I'm taking the humerus, and I'm moving in an anterior direction. Holding that, or I could do oscillations. I could do grade 2 oscillations, which is a little bit of a glide, then oscillate in that, which is a larger amplitude and slower frequency. Okay, great. Okay, we're going to do anterior glide from a prone position. So again, my position on my left hand is just slightly pulling. It's grade 1. My hand position is on the head of the humerus, and I'm going to do an anterior glide in this direction, a sustained grade 2, which is taking up the slack. And you'll feel different people have different feeling of movement. Megan is fairly flexible, so it doesn't take a lot of force to take up the slack of the joint. So that's an anterior glide, sustained grade 2. If I want to do oscillations from this position, let's say oscillations 2, which is a little bit of a glide, and I'm oscillating. The amplitude is larger, and the frequency or the speed in which I'm doing them is a little slower. Again, those diminish muscle spasms, muscle tone around the joint, increase synovial fluid movement, and help to diminish pain. Great. So we're going to do some anterior and posterior, medial and lateral oscillations of the knee. Give you another version of doing oscillations. So doing grade 1 oscillation anterior is it's a low amplitude, high frequency. So it's very little movement. So I'm doing towards me. So I'm pulling and doing towards me. Now, if I want to do oscillations 2, I do a little bit of a glide, and I do oscillations and a little slower. The amplitude is larger and the frequency is lower. If I want to switch and go to oscillations 4 towards me, I'm going to do more of a glide.